It's difficult to talk about boundaries in Islamic counseling if we don't compare them to mainstream understanding of boundaries. So that's exactly how we're going to go through this mini session, okay? So it is actually your therapist, your counselor duty to keep the boundaries. And boundaries, they mean many, many things in this therapeutic alliance. They can pertain to confidentiality, to the time you meet with your therapist, to the monitoring and maintaining strategies of the process of growth. It could include ethics. It could also include unwritten intricacies of being in therapy, such as flirting, highly experienced emotions to counselor and vice versa. Things which we don't think about, like touching or personal space, texting in between sessions. Boundaries cover practically every little detail, from freeze through timing to timing between the sessions. And it's done for a reason, for professional, ethical, and moral reasons. To protect you, to protect him or her as a counselor, but also to protect your therapeutic growth. Because this relationship, if you think about it, you and your counselor, you and your psychologist, you and your coach, you a psychotherapist, it's a different type of relationship. It is geared towards your needs, but also it will, if you will, it will broaden your expectations about relationships. It will also, if you allow it, it will also pave a way to healthier ways staying or creating relationships. And that cannot be done without boundaries, okay? So if you look in the dictionary, you will find out that boundaries are mostly described as something that indicates or fixes a limit or extent. And from Islamic perspective, we know that Sharia is quite rigid that way. Yes, everything is halal until proven otherwise, but we sort of have prescription for a lifestyle, thanks to Sharia, thanks to Quran, and thanks to tradition of the Prophet Sallallahu Alaihi Wasallam. So we can go into many ayats and many hadiths, and then about how to maintain those boundaries in relationships. So we know that physical distance and boundaries are very important between parents and children, between spouses, between cousins, between females and males, but also we know that emotional boundaries are a thing in Islam, right? So we can rely on many hadiths, such as the one who is given to us by Abdullah ibn Amir: whoever does not show mercy to our young ones or acknowledges the right of our elders is not one of us. So this is about showing emotions of mercy and emotions of respect. And then we have Ibn Taymiyyah, who mentions that whoever has wronged his brother with regards to his blood, his wealth, or his honor, let him come and set matters straight before there comes a day of Qiyamah. Okay, I'm not going to finish that. Saying. However, that should give you a brief understanding how everything in Sharia could be recognized as instruction for boundaries. Now, counseling, psychotherapy, coaching psychotherapy within an Islamic ethics brings another issues, or maybe another points for reflection, such as staying in the room with a male if you are a female therapist, or vice versa, going to a male therapist if you are a female. So there are strict and very clear hadith saying that it is not permissible. So how do you resolve that? Well, if there is no other source to go. If there's nobody else who can help you, then it is permissible, but obviously within the realm of higher, meaning you being really careful about how you show up, both of you, how you dress up, what is the space between you in the room. Most scholars, they will advise even keep the door open, and not maybe widely, but not keep them locked. So that's that. Now, if you are within the same room with the same gender, we still want to talk about things like touch or things like hugs or kisses, because some therapists, depending from the modality they're going to use, like humanistic or person-centered therapy, they will be inclined to those kind of closeness or expression of their empathy. They will even self-disclose. Now, if you're practicing a different modality, then you will be more guarded. And how would your Muslim client, or you as a Muslim client, see that person, that therapist? Can you trust him? Can you completely relax in her or his company? Provided at the same gender, if they don't show you empathy the way you expect that empathy. We know that we are obliged by Islamic culture, I would say, to ask things like, are you okay? Are your family okay? These can be seen from the West, from the Western point of view, very intrusive. So if you're practicing with Muslim clients, think about that, because should you not self-disclose those things, and you'll be asked about if you have children, if you're married, or if you had been married, even though you're wearing scarf, you might be asked, are you truly Muslim, right? So those things you need to be prepared for, and make it really clear to yourself and to your client, what is it that you accept or not accept in terms of boundaries. Now, I hope that was useful. I have also other tips. These are for those of you who are clients and who are struggling with in relationships, with boundaries. So there are many situations, and I can't possibly cover them in this short video. But if somebody wants to borrow something from you, if somebody wants to even borrow your time, you could make an excuse and say, yes, you can spend that time with me, you can borrow this book, or you can borrow this item from me, but please take good care of it and return it before, I don't know, weekend. Okay, we know in Islam that returning books, returning items, it's really necessary. It's part of amana, that somebody gave it to you, but you can't assume that somebody knows this hadith. You can't assume that somebody actually follows that. So reminding that in a really polite form, without religious shaming, would be part of your repertoire if you want to create healthy boundaries. And then you can come across somebody who's not really dealing well with emotional management in your company, and you say, I'm sorry, but I don't feel comfortable talking about my childhood or talking about this experience at that moment with you. Can we maybe talk about other things? Or you might say something like, oh, I don't like the way you treated me this morning. I didn't appreciate the way you spoke to me yesterday. Your words were coming across as mean and hurtful. That's how I experienced them. Please, can you be more careful next time when you use those words and when you want to say something to me, because I don't want to feel that way. And that opens a conversation without blaming another person. It's, you're starting with I. Now, some people, they will also cross your ideas of ethics and morals, including in religious ones, and how you want to communicate to them, again, in a very respectful way. You can say, oh, your views is really interesting. It's completely different to me. I think we can agree to disagree on this topic, couldn't we? Okay. Or you can say, we I don't tolerate dishonesty in this house. I don't tolerate dishonesty in relationship. Can you tell me straight about what is your truth so we can work it out and don't come back to this problem anymore? All right. So I hope that was useful. I know it's not enough time to cover boundaries, but I really believe it's a good introduction and food for thought. I'm going to see you next week.